Today, the national organization overseeing doctors in Canada is asking for forgiveness at a ceremony in downtown Victoria.
The racism and discrimination that Indigenous peoples and healthcare providers face is deplorable, and we are deeply ashamed. As the national voice of the medical profession, we are sorry for the actions and the inactions of physicians, residents, and medical students that have harmed Indigenous peoples.
Dr. Alika Fontaine is the former president of the Canadian Medical Association and says this day is an important first step.
After years of internal work, the CMA is sharing and owning its history. We recognize this apology may reopen wounds and re-traumatize First Nation, Inuit and Métis individuals, families and communities who have and continue to experience harms in Canada's healthcare system.
And according to this report called In Plain Sight, done in 2020 in BC, 84% of 9,000 Indigenous people and Indigenous healthcare workers say they experienced some type of racism and discrimination that prevented them from seeking necessary care, negatively affecting their health. These outcomes reinforce stereotypes and perpetuate the cycle of inequity. In 2022, the CMA brought on Indigenous elders, knowledge keepers, and experts to help the organization define an Indigenous health goal. This led to them reviewing its past and acknowledging the harms Indigenous people suffered, dating back to the establishment of residential schools and Indian hospitals.
The Indian hospital system embedded systemic racism and discrimination in the Canadian health system by fostering racial segregation and conditions where Indigenous patients received substandard and unsafe care. Patients were subjected to abuse, experimental treatments, and forced and coerced sterilization.
Dr. Nell Wyman says she is hopeful things will change, but there is a lot of work to do.
I'm more interested in hearing what's going to happen now, what's going to happen starting tomorrow. And I think a major driver of trying to make the healthcare system does not lie within the Indigenous physicians like myself within the system. We've been speaking up for years about how unsafe it is for patients and for ourselves, for Indigenous medical students, residents, and physicians. I think really the onus and accountability will lie with our non-Indigenous physician colleagues to take up that cause.
Tina House, APTN National News, Victoria.